Selamat petang dan salam sejahtera saya ucapkan kepada Guru Penasihat Persatuan Bulan Sabit Merah Malaysia SMK Sacred Heart, Editing Cell Phone, Barisan EJK sesi 2021 hingga 2022 dan para ahli yang saya kasihi sekalian. Jadi, pukul jam sudah sampai 2.30. Marilah kita memulakan mesyuarat hari ini pada petang ini. Sebelum kita teruskan mesyuarat, marilah kita menyanyikan lagu BSMM bersama-sama.
Bulan sabit merah di Malaysia yang berjasa untuk negara, tidak kira kaum dan agama, waktu aman atau bahaya. Di mana jua adanya sengsara, di sana ada kita. Di darat dan laut kita bersedia, walaupun diancam bahaya. Bulan sabit merah gerakkan sedunia, membantu semua yang menderita. Banyak sukarela berkhidmat dengan tabah dan bersemangat.
Seterusnya, mesyuarat akan diteruskan dengan laporan kehadiran oleh setiausaha iaitu Nicholas Lim Bingzi.
Seramai 58 ahli yang menghadiri ke mesyuarat ini.
Terima kasih saudara Nicholas Lim atas laporan kehadiran. Seterusnya, merupakan sesi pengesahan minit mesyuarat yang lepas. Jadi saudara Nicholas Lim dipersilakan.
Sekarang merupakan pengesahan mini mesyuarat yang lepas. Tarikh 29 April 2022, Jumaat, masa 3 PM hingga 3.10 PM. Aktiviti Mesyuarat Am Ke-8, tempat 5A1. Guru hadir, Cikgu Tin Xiaofo. Bilangan kehadiran 91 orang ahli. Minit mesyuarat 1.0. Kata alu-aluan pengerusi unit 1. Pengerusi unit 1 Cesehi Lian Chun telah mengalu-alukan kedatangan semua ahli ke mesyuarat ini. 1.2. AJK dan ahli-ahli telah menyanyikan lagu BSMM dengan penuh semangat dan serius. 2.0. Kehadiran 2.1. Seramai 91 ahli telah menghadiri ke mesyuarat ini. 3.0. Pengesahan mini mesyuarat yang lepas. 3.1. Setiausaha 2 unit Mr. Wong Ping Sen telah membentangkan mini mesyuarat yang lepas. 3.2. Pencadang ialah saudara Nicholas Wong dan penyokong ialah saudara Mak Aida. 4.0. Lain-lain. 4.1. Aktiviti sambutan World Record Day 2022 iaitu kuis online pada 30 April 2022 dan poster World Record Day 18 hingga iaitu pada 18 hingga 29 April 2022. 4.2. Kuis Palamera pada 30 April 2022 pada hari Sabtu. 4.3. Pertandingan foto iaitu Snap Your Act of Kindness. 4.4. UTPC World Record Day di Sibu Pejabat BSMM pada 8 Mei 2022. Mesyuarat ini telah dilakukan pada 3.10 PM. Sekarang saya memerlukan seorang penyokong. Terima kasih saudari Yong Fei. Sekarang saya memerlukan seorang pencadang. Terima kasih saudara Penili.
Terima kasih saudara Nicholas Lim. Seterusnya, saya akan menjelaskan aktiviti yang akan diadakan pada masa depan. Aktiviti yang akan datang pada minggu ini ialah duty first aid, iaitu semalam lah, duty semalam. Perlawanan bola sepak. Tarikhnya semalam 12 Mei 2022, tarikh 3 petang hingga 5:30 petang di Padang Bola Sepak Jalan Lada. Aktiviti yang seterusnya ialah duty first aid juga. Perlawanan badminton, pingpong, bola keranjang, bola jaring dan bola tapak. Tarikhnya hari ini 8 pagi hingga 7 malam. Sekarang ramai AJK kita telah menjalani duty ini. So kamu akan lihat lebih kurang orang hadir, lebih kurang AJK hadir dalam mesyuarat ini. So please, if you want to join this first aid duty, you need to serahkan nama kepada saya atau cikgu. Duty ini adalah untuk memerlukan first aider, dan kami akan memberikan peluang kepada ahli untuk mempelajari bagaimana untuk menjalankan first aid. Next slide. Next slide. Duty seterusnya ialah duty first aid, iaitu perlawanan bola sepak. Tarikh hari esok 14 Mei 2022, ada 2 time slot. Yang pagi adalah untuk 7 pagi hingga 10 pagi, dan untuk petang, time slot untuk petang ialah 3 petang hingga 6 petang. Tempatnya adalah di Padang Bola Sepak Jalan Lada. Next slide. Duty Humanitarian Journalist Competition. This is the theme for the year competition.
Ini bukan duty, ini competition.
Ya, ini adalah untuk competition. Humanitarian action in Malaysia and beyond, lessons from the past and emerging challenges, and international humanitarian law, alleviating human suffering. Next slide. Inilah gambar untuk poster untuk Young Humanitarian Journalist Competition. Sesiapa yang ada minat untuk menyertai pertandingan ini, boleh cari Jaguting Xiaofeng. Itulah semua daripada saya. Cikgu, adakah apa-apa lagi kamu mau tambah? Jika tidak ada, saya akan serahkan masa kepada cikgu untuk aktiviti yang seterusnya.
Cikgu ada beberapa perkara yang ingin disampaikan di sini ya. Okey, yang keempat ialah duty pada hari. Okey, cikgu nak maklumkan di sini ya, sila beri perhatian untuk first aid duty. Kita tidak mahu buat secara macam hanya AJK saja yang tahu. Member semua tidak tahu. Ada member yang suka membantu juga, bukan hanya AJK sahaja. Cikgu tahu ada ramai member yang juga ingin melibatkan diri dengan aktiviti seperti first aid duty. So kalau boleh kita letakkan notis untuk dapatkan kita maklumkan kepada ahli. Papan notis banyak tapi tidak diguna pakai. Jadi nasihat cikgu, sila rujuk papan notis. Begitu juga dengan AJK, sila letakkan semua first aid duty di papan notis supaya ahli kita boleh menulis nama mereka jika mereka merasakan masa itu adalah sesuai dan mereka boleh menyertai. Kita tidak mahu first aid duty hanya dilakukan oleh AJK sahaja dan ahli-ahli hanya dimaklumkan selepas duty sahaja. Sila beri perhatian. Yang seterusnya ada satu lagi duty pada hari Ahad ini. Kita ada duty di balai polis. Jangan takut, kamu bukan pergi sana untuk ditangkap oleh polis, tetapi kita membantu pihak polis untuk memberikan duty first aid. Pada pukul 7 pagi hingga pukul 5 petang di balai polis dengan kita bahagikan kepada 2 slot, pukul 7 hingga pukul 12 dan satu lagi slot pukul 2 hingga pukul 12 hingga pukul 5 supaya kamu dapat hadir. Okey, cikgu maklumkan di sini sekali lagi untuk mereka yang boleh mengikuti, sila bagi tahu nama kepada cikgu sebab cikgu tidak mahu nanti ada orang yang pergi sendiri. Anda tidak boleh pergi sendiri tanpa pengetahuan cikgu bukan AJK sebab apa-apa hal cikgu perlu tahu, cikgu perlu maklumkan kepada pihak sekolah. Bukan maklum kepada pengurusi sahaja. Kalau kamu maklumkan kepada pengurusi sahaja, sorry to say cikgu tak akan recognize apa yang kamu buat itu. Okey. Sila maklum kepada cikgu. Okey, yang seterusnya adalah yang tadi yang berkenaan dengan Young Humanitarian Journalist Competition. Sebenarnya dia ada 2 bahagian. Kalau kamu perhatikan, bahagian pertama dia ada dua pertandingan sebenarnya. Satu ialah jurnalis, maksudnya kamu akan menulis esei. Satu lagi adalah membuat video. Jadi tarikh tutup bagi pertandingan ini adalah 11 November. Jadi masih lama lagi. Kita ada lebih kurang berapa bulan lagi kita ada lebih kurang 6 bulan untuk due date. Jadi 6 bulan itu kalau kamu nak ambil video, buat video, kita kena fikirkan cerita berkenaan dengan Young Humanitarian. Dia ada tema dia di sana, iaitu tim 1 adalah Humanitarian Action in Malaysia and Beyond, lesson from the past and the emerging challenge. Tim 2 adalah International Humanitarian Law, elevating the human suffering. Kamu boleh fikirkan tema ini macam mana kamu nak fikirkan cerita untuk video anda. Jadi hadiah dia memang lumayan untuk hadiah. First prize RM1,000, second prize RM700, third prize RM500 dan untuk yang 2 lagi consolation prize RM200. Sila kalau mereka yang berminat boleh tak cari cikgu boleh terangkan lebih lanjut tentang apa yang perlu kamu sediakan untuk pertandingan ini. Okey, yang perkara yang seterusnya adalah tentang keahlian BSMM Kadet Sacred Heart. Untuk ahli yang telah membayar RM2 untuk iuran keahlian, anda boleh login masuk ke dalam website ini sekarang. Tapi nasihat cikgu untuk mereka yang tak bayar, jangan login. Kalau kamu login, cikgu dapati kamu login dengan sendiri dan memberikan tarikh lahir anda sebab sebelum ini ada 2 orang ahli yang telah login sendiri dan dia telah meletak tarikh lahir yang palsu. Memang cikgu boleh nampak seluruh 1,000 punya peserta, cikgu boleh nampak. Jangan kamu cuba-cuba curi-curi masuk login hanya untuk ahli yang telah bayar sahaja. Sebab ada berlaku perkara ini. 2 orang ahli daripada sekolah kita yang telah login dan memberikan tarikh lahir yang palsu. Iaitu dia belum cukup umur 18 tahun. Dia letak umur dia lebih daripada 18 tahun. Tak boleh cikgu boleh nampak di bahagian 1,000, seluruh 1,000 cikgu boleh nampak dan begitu juga untuk sekolah menengah SMK Sacred Heart, cikgu boleh nampak member. Hanya mereka yang telah bayar dan didaftarkan sahaja boleh login. Kenapa kita perlu login? Sebab anda perlu masuk dan lengkapkan butiran diri anda. Anda adalah pelajar yang telah cikgu daftarkan. under Persatuan Bulan Sabit Merah unit Kadet SMK Sacred Heart. Jadi anda perlu daftarkan diri anda. Maksudnya daftar di sini ialah kamu perlu melengkapkan profil anda, iaitu kamu punya alamat rumah, kamu punya nombor telefon, kamu punya tarikh lahir dan sebagainya. Sebab ada pelajar yang terpaksa, yang 2 orang pelajar itu terpaksa cikgu cari sampai ibu pejabat kebangsaan untuk settle 2 orang itu. Saya tahu siapa nama dia. Sila beri perhatian, jangan kalau tak bayar, kamu belum bayar lagi, you don't log in. Sekali kamu log in, memang kita ada rekod. Sibu sana terus akan keluar. Untuk bahagian sibu memang terus keluar rekod kamu. Nanti cikgu pula kena pening kepala. Mengapa ada pelajar yang letak tarikh lahir palsu? Dan dia log in sudah. Tanpa membayar yuran lagi. Cikgu boleh nampak. Hanya mereka yang telah bayar, kamu masuk, lengkapkan profil anda, dan yang paling penting, anda perlu downloadkan sijil keahlian anda dan e-card anda. Hanya kamu sendiri yang boleh download. Cikgu tak dapat download untuk kamu. Anda perlu masuk dan downloadkan sijil keahlian dan juga e-card anda. Anda tak ada kad yang fizikal. Kamu hanya ada kad secara virtual saja. Itu kamu kena download sendirilah. Okey. Jangan dedahkan kamu punya email kepada siapa-siapa pun. Sebab kalau mereka tahu email anda dan mereka tahu nombor kad pengenalan anda, mereka boleh log masuk dan kemudian dia boleh tukar password anda. Selepas kalau dia tukar password anda tak boleh masuk lagi. Hanya orang yang ada email anda dan dia telah tukar password kamu, dia boleh log masuk. Kita tak mahu. Dan kamu sila rahsiakan kamu punya email dan sila jangan bagi tahulah email, akaun email terlibat anda dan password anda kepada siapa-siapa. Tujuannya lah kita tidak mahu kamu macam sudah jadi member, kamu tak tahu pun kamu ada didaftarkan. Kamu punya nombor keahlian pun tidak tahu. Cikgu tak mahu macam ini ya. Okay, so sila beri perhatian untuk perkara ini ya. Okay, untuk mereka yang telah login, kamu akan masuk dan nampak kamu punya ECG itulah. Kamu ECG download dan e-card pun download. Okay. Okey, itu saja daripada cikgu dan cikgu akan teruskan lagi dengan kursus pada petang ini ya. Untuk kursus petang ini ya, cikgu akan tumpukan perhatian kepada bahagian first aid sebab cikgu nampak keadaan sekarang ramai pelajar dia tidak tahu macam mana nak buat dengan first aid. Bila kita tanya tentang first aid, dia pun kelam kabut, dia sendiri pun tidak tahu. So cikgu mahu anda cuba belajarlah sesuatu tidak mahu nanti kamu sendiri pun tidak tahu macam mana nak buat lakukan first aid dan sebagainya. Okey? Ada apa-apa masalah? Ada pertanyaan ke?
Tak.
Ada? Okey. Kalau tak ada pertanyaan, so cikgu akan mulakan dengan first aid petang ini. Okey, kita akan mulakan. Cikgu akan cuba terangkan sedikit tentang pertolongan kemas. Introduction to the first aid. So what is the first aid? So actually the first aid, the purpose of the first aid is we want to provide some helps to a sick or is provided to the first aid. Normally we provide to someone who falls sick suddenly or someone who are injured. And before we can get him to have any medical attention, and also the medical attention is by the health professional lah. So please bear in mind that we are a first aider. We all are the layman. So as the layman of a first aider, you are not a medical personnel. So you are not allowed to give any oral medicine to someone who are fall sick or someone injured. Okay, make sure no oral medicine. Kita bukan doktor so kita tak boleh ataupun pegawai perubatan ataupun pembantu pegawai perubatan. Jadi kita tak boleh bagi apa-apa ubat melalui mulut Okay. Dan kita lihat seterusnya. Okay, the objective of first aid is we want to preserve life. We want to make sure that the life is safe. Kita nak selamatkan nyawa. And also we want to prevent further injury. So if someone cut his hand and we didn't do anything, so he may lose his life because of losing too much blood. Also, we want to prevent the further injury. For example, someone who has a fracture or cross fracture, if we don't want to give the first aid to that person who are suffering from the fracture, so he might get from the cross fracture, he might become the open fracture. So when he has the open fracture, so something you have to do more on the okay tolong mute, kalau dapat tolong mute-kan kamu punya mic supaya tidak ganggu semasa kita buat kursus nanti and to promote recovery. So kita nak mempercepatkan membolehkan pemulihan dengan lebih cepat. Let's say you have a cut on your fingers. So if you don't want to put anything on the finger, you don't want to clean the wound, then later on the wound might get infected, then it becomes worse. But if you clean the wound and then you put the plaster to cover the wound, then maybe the wound will recover in 1 or 2 days. Protect yourself and the casualty. Also, one of the very important objective of giving the first aid is we want to protect yourself. Don't make yourself become a hero and lastly you lost your life. The purpose of giving first aid is we want to protect yourself, the first aider, and also the casualty. We don't want you to become a hero, you save someone, and finally you lost your life. Okay, this is not the purpose of first aider. Okay, characteristic for being an effective first aider. So we have to be observant to the surrounding. Because when you see something happen, you have to be careful. Because we don't want you all to get injured. Let's say you are doing your first aid, which is very near to the swimming pool, and then you keep on doing the first aid, and then suddenly what happened? You yourself fall into the swimming pool. Be observant to the surrounding and make sure no danger first. Okay, then become in your approach. Become in your approach means that when you want to do the first aid, you don't feel very nervous, because when you feel nervous, then what happened to the casualty? The casualty will lose confidence to you. Okay, so we have to become when you provide your first aid to the casualty. Build and maintain trust from the casualty and bystander. So in order to build the trust from the casualty and the bystander, the best way is you have to introduce yourself. And who are you? Are you a trained first aider? If you are a trained first aider, then you will give a confidence to the bystander and also the casualty. But in case if you are not a trained first aider, what I mean, the trained first aider means you know how to perform first aid that you for the injury that you face. For example, the casualty have a open wound on his leg, on his lower lip leg. So you must know what to do. You must know that you have to stop bleeding first. Then you have to reassure the victims. You have to call the ambulance. So you have to be calm and confident. Okay. Number 4, be gentle with your approach. Or make sure when you do the first aid, you don't be so rude, or you are so you have to be careful. Don't make the casualty feel lost your confidence to you lah. So you have to be gentle lah, and able to prioritize the severity of the condition and to provide the immediate assistance. Means that when you're facing a few cases in front of you, let's say you have 2 casualties, for example, you have 2 casualties in front of you. One is unconscious. One of the casualty is unconscious. Another casualty is shouting, shouting for help, crying, shouting for help, because he has a cut on his arm. So which one are you going to help first? So you have to prioritize who is most serious. So this is the first principle. According to the first principle, we will provide the first aid. We will provide the first aid who are in the most needed. Okay. So prioritize. So please, you have to give your first aid to the one who is unconscious. Who is unconscious, not the one who is shouting first. If you are alone, but let's say if you have a team of members together with you, you don't ask all the members and go and treat one casualty. You can divide your team to 2 small groups. One is to treat the unconscious casualty. Another small team or another small group, then they will go and approach to the casualty who is shouting for help. You can divide. If you have a team, let's say 2 or 3 members, okay, then call for appropriate help. Call for appropriate help. This here means, remember, you are not a doctor. You cannot say after I provide first aid to you, then the casualty is recovered already. He does not need to go and seek to see any doctor. You are a first aider. You are not a doctor. Because what I experienced before, I tell you my experience. What I experienced before, I found that a few years ago, more than 10 years ago, actually, this is a case more than 10 years ago. We have a student. He was injured during the sport day lah. Okay, so initially we all thought that he might have a strain on his knee. I don't know why, because actually he is not running. He is just squat down. He's just squat down. Actually, it's knee down. Then someone is pushing his shoulder from the back, and then when he stand up, then he feel painful on his knee. So we all thought that might be he has the strain on his knee, the muscle of his knee. And then after 2 weeks, then he come and again, and he's complaining that his knee is still very painful. And what happened is I asked him to go and to check go to hospital for the further checking. And what happened is actually his kneecap has a crack. Also, please, we are not doctor. We cannot see. So we, as a first aider, we have to ask him to check get the further checking from the hospital also. Even though it is just a small complaint. And equipped with the knowledge and skill. Okay, the best way to equip yourself with the knowledge and skill is you have to learn first aid. You have to learn first aid. First aid that you learn is just a knowledge, but the skill that you can build up is only when you go out and you involve yourself with first aid duty. Because we have so many cases, you can see when you go out for the first aid duty, you will experience many cases. Then from the cases that you face, you will sooner you will know how to handle the cases. For example, yesterday afternoon, we have some cases like the football player, they have the cramp, and some of them have this one small we can say like strain also actually. So you will know how to handle when you see this one. Maybe you will say, hey, can we put some ointment? Put some ointment on the injury parts in order to heat up. Or we want to heat up the muscle. Please don't do like this. So we have so that's why I say the skill, you can only build out your skill through the practicals. The practicals is come from first aid duty. I cannot tell you the condition, what you are going to face. But when you face the real situation, then you will know. Because from the experience that you gain. Okay? That's why I encourage you all to take part, to involve yourself in the first aid duty. Okay? Whatever you learn is not all the time can be applied. Sometimes we need to find out why this casualty have this condition. Or then you found that, okay, now then after that, next time you know what to do. So for the primary assessment, my advice is you have to check first. You have to check for two things. One is the danger of the surrounding. And the second one, you have to check on the condition of the victims or the casualty. You have to check these two. Then the second, if necessary, if the casualty is unconscious or if the casualty having the life-threatening condition, you must call. You don't say, let me do first aid first. Then only that I call. Let's say if the casualty become unconscious already, the casualty having asthma is having asthma and then he become unconscious already. You don't say I help him first, then later on I call. No, you must call first. If you have a friend, someone else that beside you, ask the friend to call for you because you know how to perform first aid. So you perform first aid first. Let your friends to call, okay? And then you have to give care to the casualty. This is what we want to see. This is the first things when you see something happen, the action. Check for the scene and the victim's condition, call to the authorities, and also we take care of the victims, okay? So assessment of a victims. When you do the assessment on the victims, you have to check on the danger, the surrounding, because we don't want you to get injured or we don't want you to get yourself into the danger condition. Like for example, you are doing the first aid in a room where you found that there is a smell of the gas leaking. What happened? When someone come in and then he switch on the fan, switch on the light, then explosion. So are the rescuer and the victim vulnerable to the danger or not? Then respond. Does the victim conscious or not? And then respond how to see whether the victim conscious or not. So you have to call him and you can tap his shoulder, call him. Then airway, is the victim has breathing or not? Is the airway blocked? Breathing, does the victim has any breathing or not? Circulation, is the victim has any pulse or sign and symptoms, and you have to very quickly, you have to check through whether the victim has have any sign or symptom of injury or not. For example, you can see the bruise, or you can see there is a cut, a wound, or a bleeding, and so on. Then maybe you can see the deformity on the limbs. Okay, danger. So the rescuer and the victim is vulnerable to the danger or not. So you have to see let's say if you have this type of sign, you don't go in. If you go in, then I tell you, sorry, later on you might get injured also, because if anything happen, you may get injured. So we don't want you to get injured, because remember, we don't want you to become a hero. First aid is to help people, not to become hero. Okay, respond. Does the victim conscious or not? In order to check whether the victim conscious or not, you have to tap and shout. Tap the shoulder of the victim and then call him. You can call him, hello, hello, hello. If he has no response means unconscious. You have to ask someone to call to the authorities, for example, ambulance. And then you just say, hello, can you help me to call to the hospital? This victim or this casualty is unconscious, or is unconscious, and report back to me after you call. Why we ask the bystander if that bystander is not your friend? He is just someone stand at the side and look at you. Why we ask him to report back to you? Because nowadays, so many people want to become a YouTuber. They want to become a Facebooker. Okay. So they want to take the video, but they don't want to provide any help. Or if you ask him, maybe he will nod his head, but he won't do anything. Make sure he call. After he call, he report back. Okay. So we give you two numbers here. One is 343333. 343333. That one is the direct line to the hospital, Cebu. So you can call, but don't play with the emergency call. We don't want you to misuse the service provided by hospital. Okay. Then airway, breathing. Are the victims still breathing or not? So you have to check. You have to open the airway. So to open the airway, this is how we do. We can head tilt. We can tilt the head and lift the chin. The purpose of we do this action is we want to push your tongues or put the tongues of the victims up. If not, if you didn't do like this, then the tongue of the victims will fall down and it will block the airway. We all know that a victim who is unconscious, he might have the difficulty of breathing. Then his breathing may be very weak. So if the tongue block the airway, sooner the victim may lose his breathing. So we have to open the airway by using the technique head tilt, chin lift. Breathing. So check for the breathing. So the way that we can check for the breathing is you can look, listen, and feel. So nowadays, maybe you're asking, how am I going to check the breathing? Maybe the victim is wearing his mask. Okay, but at least you can observe the movement of the chest. You can put your hand. You put your hand on the chest or on the abdomen. Then you can feel the movement of the chest or the abdomen of the victims. If he has a breathing, then you found that it's moving up and down, up and down. Okay. If the victim does not have any breathing, you have to call first. You have to call also. Circulation, blood circulation. Does the victim has pulse or not? But nowadays, we found that for the person who are unconscious, the pulse is very, very weak. So for our we are all the laymen, orang biasa. We are not the medical personnel. So we do not need to do the pulse checking. But this is for your for your information. In case if one day you become the medical personnel, so they will know how to check for the pulse. So normally they will check the pulse at the carotid pulse. But for the layman, normally will skip this step. But in the exam, you still have to know where to check the pulse. You can check the pulse on the carotid pulse, which is near to your voice box. Life-threatening condition. So these are the life-threatening conditions that when you face this victim having this condition, you must call. Whatever it is, you must call first. If the victim become unconscious, means that after you tap his shoulder and shout, call him, he has no response, so you must call to the hospital. if the victim has the breathing problems or no breathing or gasping. I don't know how any one of you see how the COVID-19 patient having the problem of breathing from the YouTube or from the Facebook. No? I don't know how many of you have seen about this video, but it's showing how difficult a person who has the problem of breathing. So you have to call. Or if the person, if we have a person who has the chest pain or the pressure on the chest, so you have to call, because this might have the sign showing that the victim may have the condition which is showing something wrong with the internal. Maybe he has a pressure, or maybe he has the injury, or maybe he has some diseases. I don't know. So no pulse, of course. If no pulse, you have to call. You don't say no pulse means the person already dead. You are not a doctor. You cannot say the person has no pulse. He already died, or he already dead. So no. We have to perform first aid also. Severe breathing. If a person having a severe breathing, like he has a big wound or cut on his limb or on his body, you must call ambulance. Okay. So now, step to help. You tap and shout on the victims. Look and listen and feel for the breathing. Okay. Check for the pulse. Check if he has any severe bleeding or injury or serious injury. So this is a video for us to check for an unconscious victim.
The DRS ABCD Action Plan provides first aiders with a tool to follow when approaching the scene of an accident or emergency. The plan provides a prioritised series of actions where each letter represents a step to be taken in the care of the casualty. Each step is to be completed before moving on. D is for danger. In all situations, it is important to check for dangers to yourself, the casualty or bystanders. You're no help in the first aid situation if you become a casualty yourself. Particularly be aware of dangers such as oncoming traffic, fire, fumes, blood or electricity. If possible, remove the casualty from danger or the danger from the casualty, and only continue if safe to do so. Otherwise, wait for emergency services. R is for response. Is the casualty conscious or unconscious? Ask the casualty their name, shake their shoulders and ask them to squeeze your hands. If they respond to you, then they are conscious. So continue with the DRS ABCD action plan, manage any injuries and treat for shock. However, if there is no response to your touch or questions, the casualty is unconscious. Make sure they are positioned on their back to allow easy access to the airway. S is for send for help now for all unconscious casualties. Call 000 for emergency services.
Fiona, we need to call 000.
Yes, we need an ambulance.
A is for airway. Open the mouth and check for foreign objects such as food or vomit. If the mouth is clear, leave the casualty on their back and open the airway by gently tilting the head and lifting the chin upward. This tilt and lift assists the movement of the tongue away from the back wall of the throat, allowing for an open and clear air passage. In the case of an infant under 1 year of age, the head should be placed in a neutral position, as tilting may cause airway obstruction. Ensure that the nose is also clear. If food or vomit is found in the mouth, turn the casualty onto their side and clear it with fingers. B is for breathing. Look for the chest rising and falling. Listen for the sound of breathing. Feel the air from their nose or mouth on your cheek, and feel and look for movement of your hand on their abdomen. Breathing should be checked for at least 10 seconds. If a person is breathing, their heart will be beating. Therefore, we turn the unconscious casualty onto their side. This side position establishes and maintains a clear airway, allowing the tongue to move forward in the mouth, facilitating drainage and reducing the risk of inhaling foreign material. When turning an unconscious casualty, handle them gently. Avoid any twisting of their head and spine. If a person is in a wheelchair or trapped, for example in a vehicle, and the airway is open and breathing is present, they can be managed without attempting to move them. The airway and breathing takes precedence over any other injuries, including a spinal injury. If the unconscious casualty was not breathing, you would commence cardiopulmonary resuscitation. C is for circulation. If the casualty is breathing, it is no longer recommended at this time to feel for a pulse. The first aider should quickly observe for other signs of circulation, such as skin colour and skin warmth. D is for deadly bleeding. Check for external bleeding, pooling or spurting blood loss. Control using the principles of pressure, elevation and rest. Check for internal deadly bleeding by looking for fluid coming from the ears, which indicates a possible fractured skull. Tenseness in the abdomen and thighs, indicating bleeding from the internal organs and major blood vessels. And finally, deformity of the limbs. With the action plan complete, whilst waiting for the ambulance, frequently check the airway, breathing and circulation. Keep the casualty warm, manage other injuries, check for identification and any medications.
Can you just tell them that he's on some sort of medication?
Yeah, we found some medication.
Telephone 000 again should you need to update any information.
Okay, so that just now you see the victim is unconscious, but the victim has breathing and pulse. So that's why the lady didn't check for the pulse, or because after she checked, so she found that the old man has breathing. So she didn't further for checking for the pulse, but she checked for the skin, whether the skin is it cool or is there any sweating or some and so on. So this is how we can check on the victims, or for the case when the victim is having the become unconscious. Okay, so not necessarily every time you have to check for the, or you have to check for the pulse. Or depend on the condition. If the victim has the breathing, then you don't have to check for the pulse. Okay, then we continue. Okay, so I try to make it bigger so it's easier for you to see. Okay, now let's go further. So next we go further to this one. Okay, so for the case when you have the, okay, now when you have this, these are the things that you need to tell the, when you make a tell the operator when you need to make a phone call or an emergency call. So you have to provide your name, your contact number, the location, if possible, the exact location, the type of the cases, causes of the incident, or is it a car accident, or someone fall down from the tree, and so on. Okay, then number of the casualty and their condition, and what are the assistance that you have provided to the casualty. And you have to put down, you can only put down the form only after you are asked by the operator to do so. Okay, so just now we talk about the level of the consciousness. For the level of the consciousness, we have four levels. First one, A is alert. Alert means you can give immediate response. For example, when you call the victim, then the victim say yes. Okay, so if he can give you immediate response, so he is alert. Verbal, the victim may not able to give you response. So unless if you call him, or he can, if someone is calling him. So he will only respond to the sound. Pain is after you call the victim, he may not give you the response. So you have to, maybe you can tap his shoulder and call him, or tap his shoulder, or maybe you have to squeeze his hand or his fingers or his leg. Then he feel pain, then the casualty will show response to the pain. Unconscious means no conscious to no response to all the stimuli that we give. So this is the level of the consciousness, LVPU. Okay, then when you examine the conscious victims, you have to see what are the conditions. Is there any part of the body bleeding, wounds, blues, swollen, compression, and painful. Checking the breathing of the victims, see whether the victim is gasping or stuttering sound or abnormal breathing. Okay, so these are this is how we can observe the breathing of victims. Okay, so we'll look at this one first. The video.
By asking questions and performing a head-to-toe check. Begin by interviewing the person, or if necessary, any bystanders. Use the mnemonic sample as a tool to remember the interview questions.
So what's going on? Are you in pain?
My arm really hurts. I tripped and fell.
Okay. How are you feeling otherwise? Do you have pain anywhere else? Any shortness of breath, chest pain, or dizziness?
No.
Okay. Let me ask you a few more questions, and then we'll take a look at that arm. Is that okay?
Mm-hmm.
Are you allergic to anything?
Penicillin?
Okay. And what happens when you take penicillin? Have you ever had a severe reaction to it?
No, just a mild rash.
Okay. Are you taking any medications currently?
I'm on blood pressure medication.
And when did you take it last?
This morning.
So do you have any other medical conditions?
No.
When was the last time you had anything to eat or drink?
This morning, a bowl of cereal for breakfast. It's a couple hours ago.
So tell me what happened right before you hurt your arm.
I was going to lunch and I tripped over a crack in the sidewalk. I'm just so clumsy.
Oh, I've been the same myself. Don't worry about it. And did you hit your head when you fell?
No.
Okay, that's good.
Once you've asked the person these questions, look at and gently feel each part of the body from head to toe, checking for signs of injury or illness.
Okay, I'm going to check you now for any other injuries. Do you mind if I touch you?
I don't mind.
Okay, I'm going to start with your head first. I'm going to take a look first. Okay. Does this hurt?
No.
And this?
Mm-mm.
Okay. Now take a deep breath for me. And breathe out. Does it hurt to take a breath?
No, it doesn't.
Okay. And are you having any stomach pain?
No.
And are you having any hip pain at all?
None.
Okay, that's good. I'm going to take a look at your leg now, okay?
Okay.
Does this hurt?
No.
And this? Ooh, it looks like you have a bruise there. We'll take care of that too, okay?
Okay.
And can you wiggle your toes for me? Are you in pain?
No.
Okay, good. Does that hurt?
No.
How about this?
Doesn't hurt.
And can you wiggle your toes for me over here? Any pain?
No pain.
Good. I'm going to feel your arm now, okay?
Okay.
Does this hurt?
No.
And this?
No.
Can you wiggle your fingers for me? Good. Okay, I'm going to feel your injured arm now, but I won't touch the bruised area, okay?
Okay.
Does this hurt?
No, it doesn't.
And this?
Nope.
And can you wiggle your fingers for me? Good. Are you having any back pain?
None.
Good. Let's take care of those bruises now, okay?
Okay.
Once you've completed a physical check of the body, provide care for any conditions you find. If necessary, send someone to call 911.
So just now you see this lady has the response. She is a conscious victim. So you can check according to the condition by using this one, this mnemonic. We have the S for checking for the sign and the symptom. Then after that, we ask whether the victim has any allergy or not. SA. Then M is the medications, or whether the victim is under medication or not, any medication or not. Then you have the P. P is the pertinent medical history, so or the past medical history lah. Maybe the victim before this she is a COVID-19 patient, or maybe before this she has a surgery on her on her heart or some. It depends now. Maybe before this lady she has she is a cancer patient before this. We don't know. So you have to ask. Then we go to the L. L is the last food or drinks that she has taken, because we don't know what is happening. Maybe the food that she take might causing the allergy and so on. Then E is the event. So she tell her about what are the event happened just now causing her. She has a injury on her arm. So event leading up to the incident. So SAMPLE, sample. So this is what we can follow in order to ask the victims. And when you start doing the checking on the victim, so we will follow the step where we will start from the head and the neck of the victim. So see any injury or not, any bruise or not. Then shoulder, then the chest and the abdomen. Ask her to take a deep breath. See is there any whether she feel pain when she has a deep breath or not. Then after that, ask her see is that whether she has any pain or injury on her hips. Then leg and feet. That's why after when she start you check. Then finally this first aider discovered that actually this lady have the injury or the bruise on her right ankle. Then after that, she go for the arm and hand. Is it okay? So this is how we can check on the victims who is conscious. Means she can answer your questions. Okay? So we'll stop over here. Then I would like you all to write down your your attendance. Sila tuliskan kehadiran anda. Cikgu akan postkan kehadiran di sini. Tapi sebelum itu, cikgu ada beberapa lagi pengumuman yang perlu diberitahu. Yang pertama, cikgu nak share sekejap untuk pengumuman untuk yang tadi sebab tadi cikgu separuh habis saja. Okey. Untuk keahlian sudah cikgu siap. Okey, untuk kehadiran ahli untuk next week cikgu bercadang nak buat aktiviti secara bersemuka. Aktiviti secara bersemuka mulai 20 Mei sebab semua telah dimaklumkan pada hari perhimpunan hari Jumaat, hari Rabu lepas. You are already told by our PK1 all the activity will come back as usual with the 100% of the capacities of the place that we have. So kita akan mengadakan aktiviti secara bersemuka sudah. So kehadiran ahli adalah wajib. Cikgu tidak mahu banyak alasan mengatakan bolehkah saya tak hadir kah? Bolehkah saya tak payah datang kah? Kalau macam itu, kenapa kamu datang ke sekolah untuk belajar? Wahalnya kamu takut untuk bersemuka dengan aktiviti KK. Kalau kamu takut kena jangkitan, kenapa kamu berani datang ke sekolah untuk belajar? Jangan bagi tahu cikgu kamu tidak akan pergi ke toilet. Jangan bagi tahu cikgu kamu tidak akan pergi ke mana-mana kantin ke. Tak mungkin kan? Lagipun memang telah dimaklumkan semua kita akan mengikut aktiviti seperti yang dikehendaki oleh pihak sekolah. Jangan kita kata saya masih lagi mau hidup macam tahun 2020 ataupun tahun 2021 lah. Kecuali kamu tak mau. berdepan dengan keadaan sebenar. Dan jangan bagi tahu saya dari tahun 2020 sampai hari ini kamu tak pernah keluar pun. Tak pernah pergi supermarket pun. Tak pernah pergi ke kedai kopi ya, tak mungkin lah. Okey ya, so kita akan mengadakan aktiviti ya secara bersemuka mulai 20 Mei. Dan cikgu akan merancang supaya kita akan belajar first aid. Kita akan belajar sedikit first aid secara untuk praktikal dan juga teori. Okey, supaya kita dapat equipkan diri kita dengan first aid. Okey, dan ada satu lagi perkara tentang pakaian survey ya. This is a survey that required by our Red Crescent because this is something related to you. Because what you are going to feel here, it will become the realities in the future. Ini ada berkaitan dengan uniform kamu untuk tahun akan datang. Uniform. Jadi anda boleh klik, ini tak perlu ini bukan untuk anda. Ini adalah untuk anda. Anda boleh klik ataupun kamu scan untuk menjawab, untuk memberikan maklum balas anda kepada uniform dan juga t-shirt anda. Okey. Dan akhir sekali cikgu akan share untuk link kehadiran petang ini dan kita akan bersurai sekejap lagi. So cikgu serahkan masa kepada pengurusi Jason He.
Terima kasih kepada ucapan ceramah cikgu. Sekarang sila isikan orang ini dan boleh leave lah. Terima kasih atas kehadiran kamu pada hari ini.